Hi, I'm Mark Sampati from the Cryo Sports Treatment Clinic. Actually, that's my foot. You're probably sick of seeing my face. So what I thought I'd talk about today is plantar fasciitis. It's a common condition that generally happens in people in their 30 to 60-year-old age bracket. And it basically is pain that originates around the arch or the heel. The plantar fascia, or plantar aponeurosis, as you can see in the chart here, it basically is a big wad of thick tissue that goes from the heel, and it comes up and it actually covers all the muscles and tendons in the foot and goes into the foot. It's like a big spring ligament that actually makes pushing off when we walk more efficient. A plantar fascia or plantar aponeurosis takes up the tension within the in the band, and then it releases that energy as we walk or when we run. Unfortunately, in some people, especially in people that have flat feet, it can cause overload, and you get a breakdown of the tissue, particularly where it attaches to the bone here. If it is chronic, sometimes you can actually get a spur on the bone in the base of the calcaneus or the heel bone there. The way that we manage it, we usually use treatments to try and encourage the healing of the plantar fascia. Massage can be a good one. I use dry needling in really stubborn cases. The podiatrists in our clinic also have a treatment called shockwave therapy that can be quite good. Basically, you're trying to stimulate a healing response in the tissue, but you also need to address the things that are causing it. So if you've got flat feet, you really need to work on improving the support around the arch. Usually tight calves go with it, so the tight muscles in the back of the leg here, if they're tight, then it puts extra load on the forefoot, and therefore the foot tends to rotate in more, and that creates problems where it's attaching to the heel down here. So stretching out your calves is a really important thing. The other thing that can really help, and you can see I've got a cricket ball and a golf ball here, is doing some self-massage using either a golf ball or a cricket ball. The other option is actually freezing a bottle of water, putting that on the floor and rolling your foot backwards and forwards on that. But I'll show you on the golf ball first. Basically getting the ball underneath your foot and just rolling it backwards and forwards. Not necessarily right up over where it's most tender here, but through the rest of the band, through the arch of the foot here. And it mobilises the joints through the foot as well. Sometimes in people that have a stiff foot, that's a really good way of loosening them up as well. You can, if you find that too aggressive with the golf ball because it's smaller, do it on a tennis ball or a cricket ball, generally something that's a bit firmer, and basically rolling backwards and forwards, moving across more laterally. And yeah, the amount of pressure that you put on it, you can vary depending on the irritability or how sore it is. So as it gets less sore, you can put a little bit more pressure on and work backwards and forwards through the length of the plantar fascia. So that's a really good way of just helping to stimulate that healing response and trying to manage the tightness and stiffness that contributes to the overload of the attachment, which then results in inflammation and pain. Sometimes cortisone injections are used, but we generally try and avoid them if we can. And the worst case scenario is that they actually operate on them and they cut it. There has been stories of people trying to rupture them, jumping off tables and trying to land forcefully enough to actually tear them. I did have one of the Supercats basketball was that I was trying to manage with the condition at training, jumped and landed, and he ruptured his plantar fascia, and that actually solved a lot of his pain problems. So it is a structure that is important, but when it's severely painful, actually cutting it or rupturing it can be a really good way of trying to get over it. So that's just a little bit about plantar fasciitis. Hope that's been helpful.